Hi guys, Rachel Cook, Doctor of Audiology at Applied Hearing Solutions in Phoenix, Arizona. And in today's video, we'll be doing part 2 of a 4-part series about earwax, hearing loss, and hearing aids designed specifically for caregivers and support members. Coming up. While many of our videos are geared towards hearing aid users on this channel, I'm often asked for resources that caregivers, support members, and family members can use to support their loved ones with hearing loss or that wear hearing aids. For that reason, today is part 2 of a 4-part series covering everything that you need to know about hearing treatment overall, moving on to all things hearing aids. Today's video will really act like an orientation to hearing aids, covering the most common hearing aid styles, different battery types, and insertion and retention of the hearing aids both in and on the ears. If you haven't yet already, make sure you go back and watch part 1 of this series about all things earwax that will be linked down in the description below. And be sure to keep an eye out for part 3 and part 4 of this series that will be coming out soon, covering how to clean your hearing aids and what follow-up care and treatment looks like moving forward. But before we dive in, if you could please give this video a thumbs up, it really helps bring videos like these to a wider audience. And if you have not yet already, go ahead and hit that subscribe button with notification bell so that you never miss any one of our newly released videos. Now, the first style of hearing aid that we are going to review today is a receiver and canal hearing aid. This is the most common type of hearing aid on the market, and understandably so, as it can fit and treat a wide variety of hearing losses. This style of hearing aid consists of the body of the device, a receiver speaker wire, and a dome or an ear mold coupling. The speaker and associated acoustic coupling on the end of the hearing aid sit within the ear canal, while the body of the hearing aid sits behind the top part of the ear. This style of device looks similar to a behind-the-ear hearing aid. These used to be the most common style of hearing aids, and they look very similar to a receiver and canal hearing aid, with the exception that they instead use a custom ear mold with open tubing rather than a receiver speaker wire. The behind-the-ear style of hearing aid is now more commonly reserved for individuals with more severe to profound levels of hearing loss. They're also used in cases when someone has chronic earwax buildup that continues to cause repairs of a receiver and canal device, or when someone might have persistent ear infections that cause a lot of drainage. And finally, there are custom hearing aids. These are built using silicone impression material or 3D ear scans to perfectly fit the individual's ear canal without any portion sitting behind the ear at all. These can range in size from teeny tiny all the way up to full shell devices that fill up the entire opening of the ear. Now, all hearing aids need some form of a power source. This comes in 2 forms: disposable battery hearing aids and rechargeable hearing aids. Disposable battery hearing aids are exactly as they sound. Tiny button cell batteries provide 3 to 10 days of battery life depending on their size, and after they all run out of juice, are then recycled. These batteries are called zinc air batteries and are sold at nearly any drugstore, grocery store with a pharmacy, or at big box retailers like Target and Walmart. Disposable batteries come in several different sizes, indicated by both a color and a number. In order from smallest to largest, they range from a size 10 to size 312, size 13, and finally size 675. Be sure to double check the battery size before you buy, since each individual hearing aid uses a different size. Because they are air activated, each battery has a sticker on top that, once peeled off, exposes that disposable battery to air and essentially activates it. For this reason, be sure to only remove the sticker from the battery once you are ready to use it. Also, be sure to give the battery about 2 full minutes to air up before you actually put it into the hearing aid. This is so that it can activate fully before being closed inside of the hearing aid battery compartment. Both new and used batteries should be stored away from pets, children, and areas where you keep similarly sized medication until they can be recycled. Recycling rules do vary by location, so make sure to do some research on what battery recycling looks like in your area. Now, rechargeable battery hearing aids do not have removable, recyclable batteries. Instead, they have internal lithium-ion batteries that take about 2 to 3 hours to get a full charge and are typically recharged when the user is sleeping, swimming, or showering. Most hearing aids do have an indicator light somewhere on the hearing aid that can tell you what level of charge the hearing aid is currently at. Red and orange colors typically indicate that the hearing aid is lower on battery, while yellow and green typically indicate that the hearing aid is getting close to that full charge. Hearing aid chargers should definitely be kept out of the reach of both children and pets, since those are the things that typically tend to mess with them the most. And they should also be stored outside of the bathroom, because bathrooms tend to have higher levels of relative humidity. Now, let's talk about insertion, because proper insertion of a hearing aid is critical for 2 reasons: retention and sound quality. Retention is important to ensure that the hearing aid actually stays inside of the user's ear and does not accidentally fall off or get lost. For this reason, all style of hearing aids have a designated right and left device, and they must be placed within the correct ear. The device side is normally indicated by a color chip on the back of the device, the color with which the serial number of that device is written onto the hearing aid itself, or with a color indicator chip located inside of the battery compartment. Not only do you need to place the device in the correct ear, but you need to make sure that the insertion is appropriate. Hearing aids that are not correctly inserted do not have the appropriate sound quality or volume that they should have. They also might squeal or whistle, a hearing aid issue called feedback. Here are some examples of proper and improper device insertion. You should absolutely schedule a visit with their provider if you notice any of the following issues: persistent feedback from the devices, repeated issues with insertion, domes or ear molds that migrate out of the ears over the course of the day, hearing aids that are falling out of the ears, visible abrasions on or in the ear, or with repeated reports of pain or discomfort from the user. Your provider may be able to make a change in receiver size or dome size, or they might even add a retention tail for extra security. They may also make modifications to custom hearing aids or custom ear molds to achieve a better fit. In the event of repeat losses, they may also suggest the use of retention aids, such as Odo clips that use short cords and an alligator clip for extra retention and to avoid loss. Overall, as a caregiver or support member, it's important to know the style of hearing aid, the type of batteries they use, and how to properly insert them into the ears of the person that you care for. It's also not a bad idea to have the phone number of their hearing care provider on speed dial. This is just in case something goes wrong or you need to schedule a return visit. That's it for part 2 of the Everything You Need to Know Caregiver series, reviewing all the things that you need to know about hearing aid styles and basics. Be sure to keep an eye out for part 3 of this series, which will be covering how to clean those hearing aids. And if you haven't already, make sure you go back to part 1 of this series about all things earwax that will be linked down in the description below.